Hello and welcome to this CME, CE certified presentation, ICD-10, Getting From Here to There, Navigating the Road Ahead. My name is Dr. Ricardo Martinez and I'm a practicing physician, and just like you, patient care is my #1 priority. Understanding and diagnosing the nature of my patient's condition is a normal part of my day. It's very exciting to see the innovations that are happening within our medical community, and that helps me provide a more precise diagnosis for my patients. Covered entities in the United States will begin using the International Classification Disease version 10, which is an improvement over the outdated ICD-9 codes that we use today. Now, the goals of today's program are twofold. Describe the overall stages and milestones generally involved in a transition to ICD-10 in a small healthcare practice, and explain how the newer ICD-10 codes may differ from the ICD-9 codes currently in use. As a practicing physician, I see the limitations of ICD-9 every day, and why input from the medical community into the development of ICD-10 has been so valuable. ICD-9 is outdated, even antiquated by today's practice standards, and it limits the speed and accuracy with which I can gather information, gain insights, and more importantly, care for my patients. Today, ICD-9 doesn't even address laterality, for instance, which signifies a condition affects the left or the right limb. On a professional note, when recently faced with a complex patient who had an acute stroke and history of a previous stroke, we had to search through many old records to determine whether that old stroke was left or right-sided, wasting valuable time that could have been dedicated to patient treatment. With a single code, ICD-10 will provide us with more detail, and better data makes better care possible. Because of physician enhancements now reflected in ICD-10, this coding classification will become the new baseline for clinical data, clinical documentation, claims processing, and public health reporting. We want to provide tools and resources to help fast-track your preparation for the ICD-10 transition. To help small provider practices and other healthcare professionals with the transition to ICD-10, the Centers for Medicare and Medicaid Services, or CMS, is actively working with physicians, industry leaders, and others. CMS provides a number of free technical assistance and training sessions like this one, and is developing other resources such as the online Road to 10 tool, which I'll introduce later in this presentation. During this presentation, I will explain the origin of ICD-10, describe how the new ICD-10 diagnosis codes differ from the current ICD-9 codes, identify the benefits of the transition, and introduce you to Road to 10, the small physician practice's route to ICD-10, which is an online ICD-10 planning and training resource that walks you through the stages of transition implementation. This presentation will focus on ICD-10 diagnosis codes, since they are the most relevant in the small provider practice setting. The ICD-10 procedure coding system, or the ICD-10 PCS, will not be addressed here, since they are related to a hospital and other settings. Healthcare has been using the International Classification of Diseases for over a century to identify and track diseases and help us improve our care for our patients. Although most of the world transitioned to ICD-10 years ago, the currently used version of the ICD-9 is fundamentally unchanged since its implementation in the United States in 1979. One major limitation of ICD-9 is that it predates many modern technological advances in clinical terminology, reflecting the use of CT scans, for example, which was also invented in 1979. Therefore, an update was necessary to account for these innovations in medicine. For years, practitioners noted the need for increased specificity within clinical terminology, documentation, and coding to accurately represent the care provided to their patients. Under sponsorship of the World Health Organization, a group of physicians developed the basic structure for ICD-10. Then, each specialty provided input on the subset of procedure or diagnosis codes needed. Addressing both the changes in medicine and the need for increased specificity, ICD-10 will capture greater detail in the clinical encounter for each patient. This is especially helpful with the increase in electronic sharing of health records and the need for clinicians to communicate and collaborate about patient care. Let's explore the differences between the older ICD-9 codes and the newer enhanced ICD-10 codes. Now, there are 7 main differences between the current ICD-9 codes and the new ICD-10 codes. Number 1 is laterality. ICD-10 increases the codes by specifying laterality, especially in the areas of injury and neoplasm. In fact, simply specifying right, left, or bilateral addresses more than 40% of the new ICD-10 codes. Number 2, while ICD-9 codes have no placeholder characteristics, ICD-10 uses X placeholders for certain codes to allow for future expansion. Number 3 is the overall number of available codes. Currently, ICD-9 has about 14,000 codes. With the ability to capture increased specificity and align with current clinical terminology, ICD-10 has 69,000 codes. However, only a subset of these 69,000 codes is most relevant to the patient care within your area of practice. Number 4, ICD-9 has limited severity parameters. ICD-10 expands the severity parameters. Number 5, ICD-10 expands the combination codes to better capture complexity of our patients. Number 6, ICD-9 has only one type of excludes notes. ICD-10 has 2 types of exclude notes. And number 7, the number of characters changes. While ICD-9 codes are 3 to 5 characters, the ICD-10 codes are 7 characters. Character 1 is alpha, 2 is numeric, and 3 to 7 are either alpha or numeric, and the decimal is placed after the 3rd character. The ICD-10 characters support flexibility and expandability. In addition to these 7 differences, ICD-10 incorporates a few other important changes. Injuries are now grouped by anatomic site instead of the type of injury. The V and E codes are now incorporated into the main classification rather than separated into supplementary classifications. And the new codes definitions are provided where necessary to reflect modern medical practice. The classification of certain diseases and disorders may be different in a number of ICD-10 chapters due to category restructuring and code reorganizations or as a reflection of current medical knowledge. While some conditions require very minor changes in codes and documentation, others would be much more significantly affected by the transition to ICD-10. For example, orthopedics is one of the most heavily impacted specialties. Let's look at a sample scenario and explore the differences between the older ICD-9 codes and the newer enhanced ICD-10 codes. The scenario is a male patient comes in for his first follow-up visit for a left femur fracture. Now, he sustained a crush injury in an on-the-job accident involving a forklift. So what are the characteristics of documenting fractures in ICD-10? The circumstances of the injury, such as where and how it occurred, are important for claims processing and coordination of benefits. And when documenting fractures in ICD-10, 9 characteristics must be determined. The type of fracture. In this case, it's an open fracture. The fracture pattern. In this scenario, the patient's fracture is a transverse pattern. The localization or location. In this scenario, the location of the patient's fracture is the middle of the left femoral shaft. Displacement. In this example, the fracture is displaced. Classification. The fracture in this case is a Gustilo class 2. And the encounter of care, well, although this is a follow-up visit, it is a subsequent encounter. Healing status. The fracture shows routine healing, and any complications, whether acute or delayed, are also documented. In this case, there are no complications present in this scenario. And then last, the etiology to document in the external cause code. We do not have enough detail in this particular case to know what happened with the forklift or the patient's role with the forklift, whether they're a driver, a passenger, or a bystander. Therefore, the etiology to document in the external cause codes is unknown. In ICD-9, this would be an open fracture of the shaft of the femur, or ICD-9 CM 821.11. In ICD-10, we're more specific. Displaced transverse fracture of the shaft of the left femur, subsequent encounter for open fracture type 1 or 2 with routine healing. That would be ICD-10 CM S72.322E. Much more specific, greater detail. So as you can see, the ICD-10 code definitely adds detail and specificity that will be helpful not only in the current case, but also in potential future care of this patient. Knowing what ICD-10 is, how it evolved, and the main differences from ICD-9 are a great start. However, realizing there are benefits to your practice can also put the transition into perspective. So today, we'll focus on 4 key areas of your practice: clinical, operational, professional, and financial. Clinically, ICD-10 will allow for easier research of patients' medical history and increased public health reporting and long-term tracking of illnesses, enable patient segmentation for care, improve protocols, and provide new insights into clinical care. Ultimately, ICD-10 will result in more accurate and complete clinical decisions from improved data collection and evaluation. Operationally, ICD-10 supports practice transition to risk-sharing models with more precise data for patients and populations and affords more targeted capital investment to meet practice needs through better specificity of patient conditions. ICD-10 also enhances the definition of patient conditions, providing improved matching of professional resources and care teams with the needs of the patients. Professionally, ICD-10 provides clear, objective data for credentialing, privileging, and quality reporting. ICD-10 also improves reporting, aids in prevention and detection of healthcare fraud and abuse, and provides more specific data to support physician advocacy of health and public health policy. And ICD-10 also improves data for peer comparison and utilization benchmarking and better documentation of patient complexity and level of care. And now that we understand the key benefits of implementing this transition for your practice, let's look at the process of preparing for the transition. I'd like to introduce an industry-inspired tool, the Road to 10, the Small Physician Practices Route to ICD-10, which is an online resource to help small provider practices transition to ICD-10. This tool, developed by CMS in collaboration with industry partners, allows small clinical practices to create a customized action plan for ICD-10 readiness and preparation. This resource also includes more information on the background and benefits of ICD-10. The customized action plan on the Road to 10 website has 5 distinct steps that correlate to the stages of preparation: planning, training, updating, engaging the partners, and testing. I'm going to use a sample family practice action plan and explain each step as we walk through it. So let's plan our journey. How will ICD-10 affect your practice? Early on in the preparation of ICD-10 transition, you need to determine where diagnosis codes are used in your practice. Identify the team members who will join you on the journey and prepare a practical but thorough budget. We developed several tools and resources to get small provider practices started on the path to ICD-10 implementation. The ICD-10 transition will include team members from your practice, such as clinical and nursing professionals, office managers, medical assistants, and even billers and coders. The first tool, a set of common ICD-9 diagnosis codes for your specialty mapped to the corresponding ICD-10 codes. Based on claims data analysis from a variety of sources, these are some of the codes that your practice type is more likely to see most frequently and have the most potential to positively or negatively impact clinical productivity according to your level of preparation and ability to submit compliant ICD-10 codes based on the dates of service. This list gives you a great jump start to think about the codes that matter in your practice. You'll want to compare these codes to your own practice experience to account for your specific patient population. Now, these codes are grouped in an expandable list by common conditions within each specialty. As you can see here in this family practice example, 12 conditions are listed with the relevant current ICD-9 CM codes, and each is expandable when clicked. As shown here, abdominal pain is now 12 new ICD-10 codes with much greater specificity, allowing you to choose a code that most closely matches your patient's condition. The second tool, Train Our Team, is a set of clinical scenarios specific to your specialty. These scenarios highlight some of the key differences between clinical documentation under ICD-9 compared to ICD-10 and the implications to your practice. These examples illustrate the importance of including the appropriate level of detail to substantiate the more specific ICD-10 diagnosis code selection. As illustrated in this family practice scenario, the patient is a 47-year-old with mid-abdominal epigastric pain. Other details about the patient's history, exam, and assessment and plan are shown. And below these details, our sample scenario presents a summary of impacts on clinical documentation and coding based on ICD-10 changes, as well as any other effects. In this example, the impact is minimal. There's a primer about clinical documentation. This document features best practices on documentation for common conditions associated with your area of practice. It emphasizes the increased specificity and laterality that can now be captured by the ICD-10 codes and provides a brief description of the documentation nuances that a coder should look for. In this family practice primer, you can see how the color-coded changes related to definition changes, the terminology differences, and the increased specificity. Each change can be clicked to view the explanation. For example, expanding hypertension shows the definition change from benign or malignant to primary and secondary, etc. This section also shows what documentation may be most important to correct code selection and gives examples of the new ICD-10 codes. By expanding asthma, however, you can see the terminology differences based on the current classification system, and by expanding abdominal pain, you can see an example of increased specificity that can be captured in the new ICD-10 code examples. In addition to these three tools, we've highlighted several training and education resources in the industry that cover core ICD-10 competencies for clinical documentation, coding, and administrative overview. This resource list includes links to each resource. For example, coding training will be specifically needed to address anatomy and physiology. The education and training resource list provides industry-recognized organizations that do provide this type of training. Step 3 is update our processes. Key action steps are outlined by function area that your practice needs to follow. The function areas include improving clinical documentation, revising paper forms and templates, and modifying policies and procedures. Like some other steps in the action plan, update our processes has a checklist with multiple action items that can be used to track your practice's progress. Engage our partners is step 4 of the action plan on the Road to 10 online resource. This section provides information on coordinating ICD-10 implementation activities with your key trading partners such as payers, clearinghouses, technology vendors, and third-party administrators. The portal provides assessments that you can send to your clearinghouse, your EMR vendor, practice management system vendor, billing service, and payers to gauge where they are in the ICD-10 implementation process. The assessments help determine which applications are affected by ICD-10, how those applications will be updated to accommodate ICD-10, how your vendor will handle reporting, and what is the testing timeline. This step also includes a checklist of activities to be completed in regards to your technology partners. You can track your progress by marking items complete. Unlike with version 4010, where clearinghouses were able to translate claims into version 5010 format, the transition to ICD-10 starts with your practice. You are responsible for submitting claims in version 5010 format with the ICD-10 codes to your clearinghouse and/or payer. The last step, test our systems and processes, introduces a plan for internal and external testing for your practice, and it covers 4 main topics. Prepare or obtain test cases. Conduct internal testing of affected systems and workflow processes and remediate systems as needed. Conduct external testing of relevant HIPAA and non-standard transactions and remediate systems as needed. And practice coding in ICD-10. Prior to beginning testing, you'll need to prepare or obtain real-world test cases. In this step of the action plan, we've provided a checklist of action items with notes and some resource links to help you complete each task. Internal testing should begin after you've updated versions of systems affected by the ICD-10 transition and completed the system setup and configurations necessary within your practice. This industry-developed checklist explains how to use your test cases to test your systems and document the results. External testing with your trading partners is necessary to ensure that you can submit, receive, and process claims data containing ICD-10 codes and helps to identify and address issues prior to the transition date. This testing should begin once your internal testing is complete. In addition to testing with your MAC, it's important to engage in testing with your other trading partners as well. And this checklist provided in the action plan outlines steps with the descriptions and notes. As you complete items on the list, your progress can be tracked right in your action plan. Your practice can increase proficiency by practicing coding in ICD-10, which helps verify whether your clinical documentation contains sufficient detail. The provided checklist will help you apply a practice and validation strategy. And as with all checklists on the road to ICD-10, you can track your progress. These 5 steps that are outlined in the online tools include a lot of information and opportunities for action. By delegating specific elements of these checklists, you can involve the appropriate members of your staff in the preparation of a successful ICD-10 transition. In summary, remember, ICD-10 fits into the larger picture of e-health: improved clinical data, capture and sharing, improved quality of patient care, and more detailed public health information. But the clock is ticking. So take action today to prepare your practice for tomorrow, and by using the tools, training, and resources discussed in this presentation to help you through the transition. This tool helps build a transition plan, take actionable steps, and see the results. It provides a 5-step action plan. Plan your journey, train your team, update your systems and processes, engage your partners, and then test your systems and processes. I hope the information covered today helps to ease your concerns and gives you a better understanding of the transition to ICD-10. The online tool, Road to 10, the Small Physician Practices Route to ICD-10, is now available to all provider practices. Use this online tool, and you'll see that preparing for ICD-10 implementation truly is achievable. I'd like to thank you for participating in this educational activity. To proceed to the online CME CE test, click on the Earn CME Credit link.